Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And, I saw the topic for today's episode, and I was going, this isn't exciting. How is this exciting?
This is exciting.
This is exciting? Okay.
Because we in Del Norte have a syphilis outbreak, and this is a way to answer that. And sadly, I don't think a lot of healthcare providers rurally actually know this is a thing. This kind of just blew up recently.
Okay.
And what we're talking about is actually two sides of the same nickel. Doxycycline and its uses before unprotected sex to protect you from getting infections.
Oh, whoa.
And after, kind of like a post-coital infectious disease protection. So
I was trying to make a cigarette joke, but I won't.
Yeah,
I'm sorry. Go ahead.
So, and it's all about my favorite antibiotic, doxycycline. So doxycycline, it was new when I first started medicine about 40 years ago, and it has fallen out of favor, and people look at it as kind of a weak antibiotic. But if we once had a contest at Redwood Urgent Care about what was the antibiotic you were most likely to pack if you were going to be trapped on a desert island, and everybody said doxycycline.
Why?
Because it's got so many uses. Super helpful.
Is it kind of suffer from that because it's got so many uses and it's not as focused as
Apparently
others?
not. Resistance is not that big a deal with this antibiotic.
Okay.
But that's a concern that we'll address too. So it's usually used, it's been around for a long time, usually used for MRSA and acne for, like average patient, but can also be used for atypical pneumonia, anthrax, malaria, chlamydia, apparently syphilis if you're allergic to the penicillin injections, and, all kinds of other stuff. And I think it's got such wide use because it's partially an anti-inflammatory and then partially an antibiotic.
Okay, now how would those things sort of dovetail and make it better?
Well, the antibiotic addresses the bacterial cause of the illness, but the anti-inflammatory, like when we get the Del Norte crud and we cough for 6 weeks, that's not necessarily infection. Even if you cough up green sputum, that is more likely inflammation in the lungs. And so when somebody is asking for antibiotics in that situation and I respond with doxycycline, I'm treating the inflammation, and they think they're treating a bacterial infection.
As a healthcare person, as a healthcare provider, do you sort of skate the whole concern about antibiotic
I talk about it.
resistance?
If they get it from me, then they have to listen to me on my soapbox.
No. You stepped up on your soapbox too. Is it because does the use of doxycycline sort of alleviate that issue? You said it's not so much resistance isn't so big a concern with doxycycline,
right? But still, no antibiotic is truly going to take care of a viral infection.
Well, no, of course not. Of course not. I'm speaking specifically in the concerns about antibiotics no longer working in the future. And you said that's not so much of an issue with doxycycline.
Right.
And I was asking, is that then part of your here, just have some doxycycline?
Yeah, I don't say it like that, but yeah. I'll say, look, I'm giving this to you because, and they're like, whatever, just give it.
You just so long as I get it, sure, okay.
Yeah, so kind of all-purpose antibiotic. So the way of taking this antibiotic is you can take it in the 24 hours before you're hoping to have unprotected sex.
I'm sorry, you're planning unprotected sex. Okay.
Something's going on. Or taking it within 24 to 72 hours after actually having unprotected sex.
Wow, okay.
So two sides of the same nickel. I was getting all confused about doxypep and doxyprep and how am I going to say that, enunciate that carefully. And then I realized it was all kind of the same thing. So PEP is like a morning after pill for STIs. And PrEP is like, I guess, being hopeful. Like thinking ahead.
Just in case.
Yeah, just why not? So what's exciting to me about this that just kind of blew up in the medical literature recently is it decreases the risk of syphilis and chlamydia by about 2/3. Now, I saw reduction in risk for chlamydia of 88%, and then the 2/3 was kind of the syphilis. But if anybody knows medicine in Del Norte County right now, they know that there's like a wild syphilis outbreak going on.
Wow.
Yeah, and it's I've seen some pregnant women with syphilis. We worry constantly about the effects of congenital syphilis. Plus, that can kill you. It can make you crazy on the way to death. It can make horrible things happen to you. And it can be under the radar for a long time.
Right, years and years.
Yeah, years and years. And providers up here have gotten used to not really seeing it as a disease entity here. And now all of a sudden it's blown up.
So is it... And it's sort of pan? Isn't like a specific population that it's a...
I treat a lot of people who live in the swamp that have syphilis.
So I have to address the animal sounds that are going on.
Oh, okay.
We have chickens at the KFUG compound here. Excuse me, it's not a compound. At the KFUG campus, we have chickens, and we have been visited this late summer autumn by a fox. And it turns out, because a person here who lives in the campus has been catching the foxes. And so now yesterday, he caught a female. Last night, he got the male. And so the dogs are all around the trap outside. And they're going, hey, there's a fox in the trap. So I've already seen it. What he does, he takes the foxes out way down south of town and lets them go. So hopefully he will find his mate later on. But the dog's barking in the background. That's what's happening. Okay. Outside the Fug House, just for anybody who's listening and is wondering why there seems to be a pack of dogs in Health Matters. So back to it.
Back to doxycycline and syphilis. There's more chlamydia in town than gonorrhea. And there is some medical literature that says this will also prevent gonorrhea, but I don't think that's real.
Yeah.
I think that's somebody's opinion and not necessarily data driven.
Wow. And that's just because of the differences between the viruses?
They're bacteria.
I'm so sorry. Yeah. They're bacteria. Look what I remember from high school health class.
Some things, are more susceptible than other things.
Wait a minute. Gonorrhea is a bacteria?
Yeah.
Wow. I had no idea. That. I did not. I assumed all the big marquee STIs were all viruses.
Most of them, the ones that can kill you. Yeah. Gonorrhea is just annoying. It can't really kill you.
Okay, all right.
But gonorrhea is becoming more and more resistant, and there's probably exists in the world pan-resistant gonorrhea, which means resistant to all antibiotics.
Yikes.
But usually for gonorrhea, people are treated with a big old shot of Rocephin, and it's... we put numbing medicine in it, but it's still a
harpoon.
It's an owie. So the hotly disputed on the gonorrhea, but impressive numbers for chlamydia, which is kind of an under the radar threat to fertility, and syphilis, which is like a threat to life. But it will not prevent transmission of viral illnesses. This is kind of what you were alluding to, I think, in an incorrect way. But it will not prevent HIV disease or HIV infection. It will not prevent hepatitis C, which is not usually sexually transmissible, but can be. It will not prevent hepatitis B transmission, which is pretty easily sexually transmittable. It will not prevent herpes simplex virus, and it will not prevent mpox, which used to be called monkeypox. We've talked about that before. But there's medications that you can take specifically to prevent HIV transmission.
Right. That's kind of a big deal. Yeah.
So how is it used exactly? So for post-exposure prophylaxis, see, I knew I'd trip up.
And that's the PEP as opposed to the PrEP,
for
right?
PEP, post-exposure prophylaxis, you can take 200 milligram tablets or capsules of doxycycline. For the purists among us, it doesn't matter whether it's monohydrate or hyclate. Those are just two versions of the drug. And you take 2 100 milligram tabs or capsules 24 to 72 hours after unprotected sex.
Okay.
So this is postcoital.
So not too soon, right?
Right.
Yeah, that's interesting.
Yeah. And then for PrEP, which is like before, this is planning before. So you can take to 100 milligrams of tablets or capsules of doxycycline within 24 hours before unprotected intercourse. So, and then it can be repeated in 24 hours if you have another episode of unprotected intercourse. And so hypothetically, if you just took 200 milligrams once a day, like maybe a sex worker could do that, because they know what their exposure patterns are going to be. You could just be on it in perpetuity, I suppose.
Is there any concern with that, with that kind of chronic taking it?
Not so far, but there are some questions. So the problems with taking it is not known whether it'll change gut flora.
Ah, okay.
And it is not known whether resistance will develop, but hypothetically it could, but we're not seeing resistance with this particular antibiotic and other sorts of germ situations, like MRSA. This is the go-to for people who are not allergic to it, the go-to to treat MRSA.
Wow.
Because there's about 98% sensitivity for MRSA using this drug. So it wipes it out
good, yeah.
98% of the time. And it's been that way since I've been looking at antibiograms.
That hasn't changed over time.
Yeah, it hasn't changed.
I'm sorry, we skipped over the how to take it.
I know that.
Are you going to come back to it?
Yeah, I'm going to come back.
Okay, cool. All right.
So it's not known if resistance, but resistance developed for gonorrhea, which is why this is, in my opinion, not a reliable way to prevent getting gonorrhea. Although I did see that there was a 55% resistance in transmission. So it doesn't prevent really gonorrhea. And like I said, it's not going to prevent all the viral entities like Mpox, HIV, HPV, which is human papillomavirus, hepatitis C, hepatitis B, and everybody's favorite herpes. And here's the other thing I saw in some of the literature I was reading on it. It's not really known that it's durable.
Really?
So it's a separate question from resistance. Is there something that's going to keep it from working? Like maybe somebody becomes a rapid metabolizer and it doesn't get the amount of level in the bloodstream that it needs to be.
Because it's just eliminated
after
too quickly,
somebody's been doing this for a year. So durability isn't known. And I think the biggest barrier on this one is I bet you a bunch of healthcare providers don't really know this is a thing. And I bet if you go in, if you're like, hey, I'm going to think ahead, I'm going to get a prescription of this either to have just in case afterwards or hopefully before. And you're going to be talking to a provider who's just kind of looking at you going, I don't think that's a thing. Because this is brand new. This is hot off the press.
Is there anything that a person can, any sort of proof, any sort of citation they can bring with them to sway a doctor who might not know about this yet?
Yeah, I think you could have a reference from the CDC or the Mayo Clinic or something that show up. But, it's not even in my Hippocrates, which is supposed to be pretty up to date.
What's that?
Hippocrates is the app that I purchased. That's
and it's Hippocrates?
Hippocrates.
That's brilliant.
I know. It is. And it's super helpful, although it's disdained by some groups of people. But there's similar apps that exist. And I just call it, when I whip out my phone in the exam room, I just say, let me go into the medical library. So they know I'm not just texting my mom or something.
They're just Googling it, right?
Yeah. Yeah. So,
see what AI says.
Yeah. So that's where I get the antibiogram information. Sutter sells it to Hippocrates. Hippocrates prints it up. I paid $279 a year or something.
Wow. Okay.
Yeah, kind of interesting.
Is that an app that's available? I mean, is it available to anybody? Is it just is it specifically geared toward professionals?
Yes, I did not have to provide any proof that I was a healthcare provider. There's two versions of it. This is the one with training wheels.
This is
and then there's the
advanced,
turbo one. Yeah. So I find it super helpful. I'm in it like all the time.
I bet.
Yeah. But I have not seen this in Hippocrates. They talk about it as using doxycycline as off-label use to prevent Lyme disease. It's used in a similar way. If you get a tick bite, you're supposed to took off 5 risk factors, and if you get 4 of them, you're not supposed to use it, but I do it anyway.
That's interesting. Okay. Oh, wow. Wow.
Because I think there's durability here, and I don't think it's going to hurt anybody. And it might help somebody. So,
is there difficulty though? Ultimately, I mean, we talked about it. You know, if your healthcare provider isn't up to date with everything that you are, and doxycycline is, I mean, how difficult is it to walk in and go, look, hey, I just want to get some doxycycline?
Well, if it was me, if you were talking to me and I was, let's say, clueless about it, let's say the Lynn of 2 months ago, then I'll take somebody's. I'll go in and say, "Excuse me, let me look in a different medical library," and it's in up to date. So, yeah, I would say, yeah, this is a great idea. In fact, I'm going to ask. This is a cheap antibiotic. We have it for free at Del Norte Community Health Center through Direct Relief. I think they could break them down into like a little, I don't know, Friday night pack. And, you know, with you know, a couple of doses of the medication, with condoms, with information on where to get tested, blah, 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 and just hand it out. I don't see why you couldn't. And I don't see why people couldn't take it if they needed it, except if they're allergic to it.
Right.
I do not see very many people that are allergic to tetracyclines. It's mostly intolerant. So that gets to how you should take it. So there's problems with taking it. They're little problems, so you really have to take it with a lot of water, and then you have to take it with a lot of water.
Yeah, yeah.
So I say a pint glass, slam it. And you're taking 2 pills or 2 capsules together. And the reason for that is you don't, it's kind of caustic, and if it's in a little nook and cranny in your esophagus, it's going to dissolve there, and it's going to cause hypothetical problems.
I had I knew somebody had I forget what kind of pain relief it was, right? Aspirin or something like that got stuck like that and ate a hole. Yeah. And they had to go to see the doctor about it.
Right.
It was very bad.
And so we talk about this more as a side effect for like a little old lady with osteoporosis who's kind of hunched over. And not so much with a young strapping adult male, say. But it makes sense. Slam it with a lot of water. And for some people, a lot of water is like 2 ounces. That's not what I mean.
Right.
Pint glass. And you have to slam it. You can't sip it. And then you remain upright for 2 hours. None of that's a big deal. You know, I don't think so.
That might get in the way of your Friday night plans. Having to remain upright.
I'm sorry. Up to your creative inspiration.
Yes, right, exactly. Right. So, it's too much like dancing. Right. Oh my gosh.
So the other thing you have to do when you take it is you have to avoid dairy, and you know, they also say avoid calcium, antacids, and multivitamins. But what that means, those are all different ways of saying calcium.
Calcium, okay.
Because calcium impairs absorption of this antibiotic, and you might not be getting doses that are therapeutic enough to do the job.
Right.
Okay, so it's 2 hours, avoid calcium, 2 hours before or 2 hours after. So just make sure you also know that you could be unusually prone to sunburn after you take it.
What?
Especially if you're...
Really?
I know, weird.
What is...
Photosensitivity is a thing with doxycycline, especially if you're taking it frequently. Let's say somebody who's a sex worker is taking it every day, then they have to be mindful of sunburn, and otherwise they're like hypothetically going to get it. It's a weird sunburn. It's on the back of your hands.
Wow.
Usually it's pretty...
What in the world causes that?
I don't know. One of the mysteries that brought me to medicine.
Yeah.
Like, what?
Doxycycline hands.
So
what is, you said it's a member of the you referenced a word I've heard before, tetracycline.
Tetracycline.
So what's the difference between like a tetracycline antibiotic and what's another kind of antibiotic? What
like a penicillin antibiotic.
Is that different than tetracycline?
Yeah, they're not even they don't even have the same last name if you're like...
Well, yeah, exactly. But
families.
I don't know what that means.
Yeah,
so I know.
So that means that they're not, the chemical composition is radically different. So some things that, like penicillin, amoxicillin, augmentin, which is amoxicillin with clavulanic acid, all those cillins. So there's crossover allergenicity. So if somebody's allergic to penicillin, we automatically assume they're allergic to
All the
amoxicillin.
Yeah, okay.
Yeah, in doxycycline, in the tetracyclines, there's the only ones I can think of is doxy and minocycline. Offhand, there's probably a couple of more, but doxycycline by far the one that's used the most. Minocycline, kind of weird, kind of niche use for rosacea. So sometimes urinary tract infections, but there is no worry about allergenicity in somebody who's, say, allergic to penicillin. There's no allergenicity with doxycycline.
Different things.
Totally different thing. And, your doctor knows that, so you don't have to explain it to us. We automatically go there. But if you're anxious about it, certainly explain it to me. I was there, though, on that day in school.
I paid attention.
So I got that right on the test. So I think if providers could, now I see handing out little plastic bags with these meds. I think if people knew about this, if providers knew about it and provided it, and if patients knew about it and accessed it and followed through and used it, that I just think that's amazing.
That's a really handy thing to have.
Right.
Just the knowledge that that's even a tool.
Right.
That's great.
And that we can use this particular drug for doxycycline or this particular way of using other medicines to prevent HIV. And I bet you this is, they're going to take this and run with it with things like flu, for example, or COVID, or hepatitis C, or maybe hepatitis B. That's a little more complicated. But, we have a big syphilis outbreak in this community. And if we're judgmental about the people most likely to have it, and we don't care about it based on that, we should be mindful of the babies they're having.
Right. That's a big deal.
Yeah, it's a huge big deal. I've seen in my little practice 3 women with syphilis that had to be treated. It's very hard to treat people, because it has to be done in a certain way. And, somebody, for example, who's very penallergic is not going to get the optimal treatment for it. The timing has to be right. And for people who may not be, sometimes aren't anchored in time, you got public health nurses running around chasing them. It would just be better if we had a better way to deal with this before it becomes a huge problem and affects other people's lives. So that's why I wanted to bring it forward.
I'd like to take just this quick break here, this instant, to welcome. And I want to make sure I get the right station because I had to go. I had to go check the email again. KKFOLP in Klamath Falls. I was just in Klamath Falls a couple of weeks ago, catching the Amtrak and riding it up to Seattle and then coming back to Klamath Falls. And I kind of fell in love with the town. It's a cute little town. It's a working little town.
Never been there.
It seems like, unlike so many towns, especially here on the coast, it seems like they actually do things there. Like there's like a warehouse district, and that's where the train station was, and I was sort of staying on the edge of it and walking through. Yeah, cool. Like there's industry and making things and doing things. It's a real little town. So Klamath Falls KKFO picking up health matters and extending your reach, Lynn, with Health Matters now. This is the 4th station from Brookings all the way down to Eureka and then now inland to Klamath Falls. So
super exciting. Because of that, I think, because I've been bragging on
Have you
it.
been bragging? You've been walking around going, hey, well, who's a syndicated radio host? Oh, that'd be me.
There are people approaching me asking to be on this. So the next couple of months at least, there's a lot of interest for being on the show, and people are coming forward, physicians actually and nurses coming forward with good ideas.
That's wonderful. What sorts of topics are you talking about?
Well, one physician wants to talk about how diabetes affects the nervous system. And, diabetics have a 9 times greater risk of amputation. So he really wants to address that because he says he's tired of amputating limbs. Oh, cutest thing ever. And then one nurse wants to speak to CPR because she teaches it and she's done it a lot of times. And she really wants to be a positive voice for that.
Because, I didn't know this until time passed, but CPR changed over time.
It's totally different.
Right? Yeah.
I just recertified, and I'm like, what?
Wow. What sorts of things are different? I mean,
we can talk about that.
Okay, we'll talk about. I learned it back in the 80s, and I didn't realize things like that when I was in high school, or in middle school actually is where I first learned it, and then again in high school. But then, there's all kinds of timing differences and the breathing for the person differences.
Yeah, you don't have to do mouth to mouth anymore.
Wow, okay.
Mouth to mouth is out.
Wow, look at that. Here we are in the post mouth to mouth. There's a joke. There's a way to tie it back into today's topic, but I'm not going to mess with that joke right now. It's exciting. It's exciting to have people coming and wanting to be on and to share their not so. Because where we live, and this seems for all the communities that carry Health Matters, we are in an analogous spot in that we are, despite the size of Klamath Falls or Eureka, we are in a healthcare sort of desert in a way, living here in the rural communities. We've just had eggs dropped off here at the and you got the other fox, right?
Yeah, the mother.
Yep,
she's more red.
Oh, is this a female?
Yeah.
Oh, okay.
They both were. That was her baby.
Oh, all right. So we're kind of.
That could have been a male. I didn't get close enough to check.
Yeah, there wasn't. Yeah. There's a little more serious look on the face. Actually, I noticed that today, looking at it.
Yeah, she's older and meaner.
So Fox is not with. I guess we can work that into a topic at some future thing. How to protect yourself against.
It's not rabies.
Yeah, exactly. How to protect yourself against foxes. Again, I keep coming up with jokes that take us back to the topic of this show, and I can't. So just that we all sort of are in the same boat. Rural life, rural disregard in America, the resources being sucked up by urban centers, and we're sort of stuck here having to.
The assumption that urban centers have that we can do the things they think we should be able to do.
Is that a better way to put it? I mean, are the resources actually sucked up, or is it a fact that the people who allocate the resources think? Yeah,
I think it's urban arrogance.
Urban arrogance. There you go. Right. There you go. And so is our own little stalwart, our rampart against urban arrogance, to remind everybody that out here and all, when you look at the map, when we have the presidential election here in a few weeks, and you look at the map and you see all the red, that's us. That's where we are. And that's what happens, and we have to figure out. I want to reach out to the three other stations that carry Health Matters right now. The station in Klamath Falls, the one in Eureka, KZZH-LP, and the one in Brookings, Oregon, KCIW-LP. If you have any questions, any issues, anything that you would like Lynn to address, what would be the best way to get a hold of us here? Let's see.
Don't you have an email, email?
Well, we do, but that's going to change here soon because we're going to have a new website and a new host. And so all the station emails are going away. So if you have a question you would like to get to Lynn, here's what we'll do. Email me right now. Not right now, but right now the email address to use is my personal email address, which is pcritz, PCRITZ @yahoo.com. That's PCRITZ, pcritz@yahoo.com. And I'll get whatever comes in, I'll get that to Lynn. We also have big news about a substantial chunk of this year's Health Matters now being available in podcast form on a Podbean subsite that we are setting up. We're in the midst of a big reorganization and having a website built and all of these things. So if you find Health Matters as well on the KFUG Community Radio YouTube channel, you can comment there. We will see whatever you put there. But if you've got something that you would like Lynn to address for your listeners, one of these other three stations, let us know, because I'm sure she would be happy to do just that. So you were talking before we went on mic today. I forget, is next week's topic settled on, or is that still?
I think it's CPR, but I'm not sure.
Okay.
Stay tuned.
Do they bring the dummy?
Huh?
Will they bring the dummy?
No.
Okay. So we don't need the dummy.
But you too can save lives.
Ooh, okay.
It's not that hard to learn.
There you go. All right. Well, hopefully, we'll see. Tune in next week. We might be saving some lives here with Health Matters. Lynn, thanks.
You're welcome.
All right. We'll see you next time.